I'm David Deutsch. I am a physician, a former medical school professor. I am an obstetrician gynecologist who retired recently and went back to school. I did that to acquire some additional experience in public health and recently got a master's in public health degree. My association with Manu starts back with Father Sam O'Corey when he was a medical student and I was in practice in the north side of Chicago. Father Sam was asking to participate in some surgeries because he anticipated coming back to a rural area where there were no active surgeons and possibly having to help with cesarean sections or do one of those for emergency deliveries. So he worked with me, and he came back to Kampala, finished training as a family practice physician, and then came back to Chicago, and it was at that point that I found out about this Manu organization. Manu was a group of people in Wisconsin and Illinois primarily, but they were all tied together through their acquaintance with Father Sam. And they have been, over a period of years, trying to raise money and bring in equipment for improvements in medical care at a hospital in northern Uganda. I participated in that. This is the second time that I have come to Augur Hospital, and I've been asked about why I would care to participate with this particular charity, since there are many of those to which I could contribute. And I do it for a couple of reasons. One is that there's an obvious need. This is a developing country, and this is a rural area within that country. Medical resources are very limited, and in fact, within our country, most of the medical resources, 88% of the resources, are centered around one city, meaning that those resources are used to serve only 12% of the population. So anything that we can do for the rural areas that are resource deprived, I'm happy to try and help with. I don't mind contributing both time and money to this because I know that it isn't wasted. We talk about efficiency and how much of the money is used to actually improve patient care versus how much is used for staff salaries or executive salaries or advertising. And there's almost none of that with Manu. These are volunteer folks, and so there really is no overhead. And all the money goes directly to improvements in the facility and directly or indirectly into patient care. I ask about effectiveness. In other words, when we contribute, is it used to make a difference, or is it spent on the program? And it's effective. Here we have seen the establishment of an emergency room. We've seen very significant improvements in the radiology department. We have a nursing education building going out that's going to train both nurses and nurse midwives. We've established a training program for resident doctors, and we have a little library here for that. So all of those are very important things, and we're moving forward in my area. We're hoping to make some significant improvements in the maternal care area, labor and delivery. We're at a point in the development of our organization here where they talk about a production curve, but that's a public health issue, and it means very small increments, very small improvements in resources yield very large improvements in results. And we're at that early stage where almost anything, can result in a measurable improvement in care. You wonder about outcomes, and that is that if you make all these improvements, does it actually make any difference in the lives of the patients? And we were lucky enough to have a study published in December of 21 that looked at the preceding 3 years. And there are very measurable improvements in tuberculosis, in HIV, in reducing the maternal and baby death rate. There's an outreach program that's developed so that people that got no care previously are now getting care. So there are obvious improvements visible to anybody that are improvements in patient care. Finally, it's a good organization. Excuse me. What I meant to say was it's a good organization. So these are very good people, not just Father Sam and Monica, but the sisters that administer the hospital, the nurses that are training, the residents that are training. Everybody is trying to do good things, but they're also trying very hard to be good people at, excuse me, at the same time. And I like that. I like it. Excuse me, I like to identify with their efforts, and it makes me feel good to be participating with people that are working so hard to do good things in a difficult part of the world.